Let's talk about Botox and fillers. What's the difference?
Right. So Botox is a toxin produced by a bacteria called Clostridium botulinum.
Okay.
So what it does is it actually paralyzes muscle. So where we use it is usually on the forehead and around the eyes to relax muscle and prevent lines from forming. Yeah. So in simple terms, it's a muscle relaxant.
Okay.
It stops lines from forming. Fillers, on the other hand, these are injectable gels. They're made of something called hyaluronic acid,
Yeah.
which is a naturally occurring substance in our own tissue. But this hyaluronic acid is made in a lab, and it comes in different densities. So you can have soft fillers, medium fillers, dense fillers. And the reason why there's different densities is because we need different densities to that will sit right in different compartments of the face.
Okay.
Yeah. So if we're going to put a filler in the under eye area, we would use a soft filler. If you're going to use something, let's say on the nose or in the jawline, you want something very dense because you want it to have that bony look.
Okay. Okay. And how long these treatments last? And what's the maintenance like?
So Botox, you're looking about 3 to 4 months.
Okay.
So you can have a treatment once every 3-4 months or just twice a year if you like. Fillers, well, this one, it depends. So typically, as a basic answer, I would say 12 to 18 months. Okay. But the real answer is a lot more complex than that, because
it would depend on patients.
Depends on patients, depends on the filler type.
Okay.
So dense fillers will last longer. Soft fillers won't last as long.
Okay.
Also depends on the area of the face it's been injected. So if it's lips, for example, this area moves a lot more. It'll wear off faster.
Oh, okay.
If it's on the nose, for example, or in the jawline, these areas don't move so much, so it'll last longer as well.
Okay. Okay. And are there any risks with these treatments?
Generally, they're very, very safe. So you can expect just a bit of mild bruising and swelling for maybe 2 or 3 days.
Okay.
Of course, there are slightly more dangerous risks. I mean, the one that we all worry about is vascular occlusion. So this is when a vessel has been blocked by a filler. Okay. And if a vessel is blocked, it can cut off blood supply to a certain part of the face.
Oh my God. Okay.
I know it sounds very scary, but the good thing about fillers is that we can always reverse them. We can locate the vessel and we can dissolve away the filler that's in that
is
vessel.
that risk like a very quick risk after the treatment, or does that take time?
If a vascular occlusion is suspected, usually you will suspect it right there and then.
Okay.
So you'll see a paleness to the skin. And when you see paleness, that means there's a restricted blood flow to the area.
Okay. And these sort of things happen when you go to unqualified professionals, right?
Well, I mean, it can even happen if you go to a qualified professional.
Okay.
It's with the face, it's a massive network of vessels. So even though we make sure we inject in areas we know there's no important vessel, there's always a chance of still hitting a vessel because, like I said, there's vessels everywhere.
Yeah.
So, even in the hands of experienced professionals, it can happen. But the important thing is that you need to go to someone who knows how to deal with it if it happens.
Mm. And if a patient is not happy with the treatment, is it reversible in the same sitting, or do they have to come back again?
So if it's an emergency, like vascular occlusion, that needs to be dissolved straight away.
Okay.
If it's just a cosmetic thing that they don't like, so let's say they feel it's uneven or something, then I would really recommend you wait 2 weeks, because in 2 weeks, your swelling is completely gone.
Okay.
And sometimes the swelling can make things look uneven. So that's why I would say give it 2 weeks before you think about dissolving this away.
Okay. Okay. And do fillers always make you look fake?
When it's done correctly, it should never make you look fake.
So it should be minimal then, right? To make it look very natural.
I would say,
because obviously if I get a treatment done, right? My best friend who sees me literally like every week, she would notice it if it's like a drastic one. But would she notice if
it depends how observant she is.
Yeah, that also.
I mean, no, what I always say is that if a treatment's well done, the people around you, so your friends, family, they shouldn't be able to point it out and notice it. They should notice that you look better and you look more refreshed.
Yeah.
You look rejuvenated, but they shouldn't be able to pinpoint exactly what's been done. That's where I think things can look a bit fake.
Okay. And it's Botox just for older people? Like that's a 50 plus?
No, not at all. Not at all. It can be for young people and older people.
Okay. And you were saying Botox is for the forehead part, right?
Yes.
Is it done somewhere else in the face as well?
Yeah. There's a lot of places. So we can use it on the forehead, around the eyes.
Yeah.
We can use it on the nose, the chin, a big muscle called the masseter.
Yeah.
We can use it in the armpits as well.
Okay.
To stop sweating.
Okay.
We can also use it to relieve migraines. So there's a lot of other points on the head and around the neck we can use for migraines.
Yeah.
We can use it on the palms, on the soles of the feet to stop sweating. Where else can we use it? There's a lot of other places as well. Also, Botox is not only a cosmetic thing. It's also used in the hospital as well. So people with blepharospasm, so if they're having twitching eyelids, also if they have bladder issues, it's also used for that as well.
Yeah.
There's tons and tons of uses of Botox.
Okay. I know someone who got a treatment done and the doctor suggested a little bit of, I think it was Botox around the smile area, like the smile line.
Okay.
And that got really weird for a few months. She couldn't smile.
Okay.
That was very weird because we used to take pictures and it used to look like she's trying to smile, but she couldn't.
Okay.
That was very off. So yeah, is that a common place to do Botox as well?
In the right candidate. I'll be honest, I don't do a huge amount of Botox around here because of that problem that you just described.
Yeah.
I think it looks unusual when people can't speak properly, they can't drink from a cup properly.
Okay.
So I think Botox is usually better used in the upper face because you get less of those kind of problems.
Okay. And these non-surgical treatments, they are done with injections as well, right? If we talk about fillers, are they pain-free?
Very tolerable. I would say maybe 1 or 2 out of 10.
Okay.
So you feel a little sharp scratch, sometimes a bit of pressure.
Okay.
But yeah, very well tolerated.
Okay. And in your patients, what do you see after the treatments and the enhancements that they get? How does their life change?
Well, I mean, I would say the main thing is there's a confidence boost. So you see it, when they come back after 2 weeks, when all the swelling settled down.
Yeah.
They're looking good, they're feeling good. They probably have received compliments from people because they look better. So yeah, that's the main thing. It's a big confidence boost. Usually people come because they're feeling self-conscious about something.
Yeah.
And when you solve that thing, it's life-changing.
Have you seen any patient of yours whose life just changed drastically after that?
Oh, for sure. Yeah. Like I said, we deal with a lot of under eye problems, and I find that the most sort of transformative thing for somebody, because when you just talk to somebody, you're looking directly at their eyes most of the time. So if your under eyes are looking tired, if there's bags, if it looks dark, it makes you look kind of tired, ill. And then if we're able to reverse that appearance and make it look refreshed, bright, awake, that's a big thing for somebody. And you normally see that straight after the treatment because the result's instant.
Okay.